Today we are going to look at the revised Jones criteria, and this is for the acute rheumatic fever. So to begin with questions, the first question is chorea. So under chorea, this comes under the major or minor criteria. The second question is the presence of fever. So fever, where does it occur? Does it occur in the major or minor criteria? So we'll find out the answers to this and learn in detail about this topic. To begin with, we look at the major criteria. So under the major criteria, there are two headings, that is there is a low risk population as well as the other one being the moderate to high risk, moderate to the high risk. So what happens in the low risk populations? In case of low risk populations, there is the presence of carditis. There is presence of carditis, that is, it can be clinical or the subclinical. Then we move on to the arthritis. So what is the arthritis? So arthritis, so first we are dealing only with the low risk population. So arthritis, it includes the polyarthritis only. This is in case of the low risk population. And then we have the chorea and the erythema marginatum. And after this, there is a subcutaneous nodules as well. So now, just to move on to the moderate to severe risk population. So we look at the moderate to severe risk, moderate to the severe risk. So under moderate to severe risk, this is all under major. So again, it has the carditis. So carditis can be the clinical or the subclinical. Then we have the arthritis. There is arthritis. So arthritis, it indicates the polyarthritis. There is polyarthritis, the polyarthralgia, and the monoarthritis. Then we also have the chorea and the erythema marginatum. Next, we also have the subcutaneous nodules. Subcutaneous nodules. Now we move on to the minor criteria. So under minor criteria, it includes, firstly, we look at the low risk population. So in case of the low risk, this includes the fever. So fever is greater than equal to 38.5 degree Celsius. Next, there is the ESR. So ESR is considered greater than 60 mm, and this is in the first hour, very first hour, or the CRP, or the CRP being greater than 3 mg per dl. Next, we also have the prolonged. There is prolonged PR interval. So PR interval is prolonged, and this is after accounting for the age variability. So we look at the age variability, and unless the carditis is a major criterion. Next, we move on to the medium, that is the moderate to the high risk. So how does the conditions change when we go to moderate to the severe? So firstly, there is in case of low risk, there was polyarthralgia. Here it is monoarthralgia. There is monoarthralgia. Next, there is presence of fever, and there is also the ESR. ESR is greater than 30 mm per hour, whereas in case of low risk, it was greater than 60. Here is greater than 30 per mm per hour, and as well as the CRP. If you see the CRP, it is greater than 3 mg per TL. Then we also see the prolonged. There is prolongment of the PR interval. Prolongment of the PR interval, and after accounting for the age variability. So, firstly, how do we diagnose this ARF, as acute rheumatic fever? So, the first thing is initial to diagnose it initially of initial ARF, we need to do the two major. There is two major criteria, or one major, or there is one major plus two minor. There's one major plus two minor. Then we look at the recurrent. So how do you differentiate it from the recurrent? In case of the recurrent ARF, we need to look for the two major or one major and two minor or three minor criteria, and two minor or three minor criteria. Now we will be answering our questions. We are asked two questions. The first question was, where does chorea fall under? So chorea is a component of the major criterion. Then the second question was, where does fever come under? So the fever we saw was greater than 38.5, and this is nothing but a part of the minor criterion. Another thing to note is that both the features remain same throughout the low risk population as well as the moderate high risk population.